for SSM Health, and welcome to our Google Hangout. Today we're talking about the Orbera intragastric balloon, one of the latest developments in weight loss and weight management. Now, during this Google Hangout, we'd love to hear from you. Send us your question. Our expert tonight will answer those questions. You can email them in. Our email address, askssm@ssmhc.com. You can also tweet us. Our Twitter handle is SSM Health. You can also post to our Facebook page, YouTube, Google+. All you have to do is just search SSM Health. Now, as we answer your questions today, please keep in mind this is for informational purposes only. If you do have questions about your own health, please speak with your healthcare provider. Tonight we have Dr. Andrew Wheeler joining us from the SSM Health Weight Management Services. Dr. Wheeler, thanks for being with us tonight.
Hey, thanks for having me.
Tell us a little bit about SSM Health Weight Management Services and really the comprehensive programs that you guys offer here.
So at the SSM Weight Management Center, our philosophy is that we can help a person lose weight regardless of what their goals are, how much weight they want to lose, or the other medical problems that are associated with their weight that they're wanting to improve. By offering many different solutions for the many different patients, because we know that not one solution fits everyone, we feel like we can help people be successful for the long term.
And tell us a little bit about one of the newest programs that you guys have here, the Orbera intragastric balloon.
Yeah, so the Orbera balloon is a new FDA-approved device. It's been a device that has been around for quite a while in Europe, but it's a non-surgical solution to aid a person in this comprehensive weight management approach to their weight loss. The goal is that it amplifies a person's weight loss in order to help a person be more successful. So obesity, we know, has been increasing in the United States as well as around the world. As this slide shows, over the last almost 20 years, rates of obesity have increased quite significantly across the United States. What this means is that there's an increased social as well as economic impact on both the individual as well as the United States. 1 in 3 U.S. adults are now believed to be obese. The problem with this both comes down from social, economic, as well as from a health standpoint. Socially, we know that people suffer increased bias or discrimination because of their weight. They deal with judgmental behavior, as well as the potential health impacts of premature aging, compromised health, increasing medical problems, and most significantly, an increased death rate. Economically, this impacts a person both because they're not able to function at their job sometimes as well as they would be able to, potentially increased time missing work because of the other associated medical problems with obesity, in addition to the impact that obesity has on the United States as a whole from a healthcare perspective. A lot of weight loss options are out there, and it's quite daunting for a person when they start to look at all the different potential ways to lose weight. It comes from peer support, talking with friends, potentially family members, what the media says, what commercials say, potentially even TV personalities that have tried or done certain things. Traditionally, we know that diet and exercise is the least invasive way to try and lose weight. Unfortunately, it offers a very low amount of weight loss for most people. 95 to 97% of people don't successfully lose a large amount of weight and keep it off. On the other end of the spectrum is surgical options. Surgical options are highly effective, offer a large amount of weight loss, and are very successful for most people, but they do come at the increased potential risks that are associated with surgical procedures. Towards the side of diet and exercise, there are medications. New medications, safer medications are coming out all the time. Many now are approved by the FDA, and many which we prescribe here at the SSM Weight Management Center. Unfortunately, pharmaceutical options do not offer a significant amount of more weight loss than diet and exercise in some people. This leaves a gap. It leaves a gap in what do we offer people who are either A, not candidates for surgery, or do not, but what they want to be more successful than diet and medications alone. And that's where we now have a place to fill in the gap with the Orbera balloon. The Orbera balloon has now been FDA approved for about 3.5 months. In early August, it came out as FDA approved, and it offers an incisionless, non-surgical option to help fuel a person's weight loss efforts. It's the boost that can help a person go from diet and exercise it can be very, very difficult to augmenting and making that diet and exercise actually be successful for a person, with then incorporating those lifestyle changes to help a person be successful for the long term. So how does the Orbera balloon work? It looks like a very strange device when a person thinks about having that in their stomach. It's not a device that you swallow, okay? We're not going to have anyone try and ingest this entire balloon, but it is something that I can place using a non-surgical endoscopy. It takes up about 1/3 the space of your stomach. By taking up 1/3 the space of your stomach, it helps you eat a smaller meal. Now, what a lot of people experience when they try and diet is when they eat a smaller meal, they're hungry all the time. That's not laziness. That's not a lack of willpower. That's your body's hormones resisting the weight loss. The body is wired to maintain the weight that you're at. And it fights against weight loss with probably hundreds of different hormones to help you maintain the weight that you're at. That's a problem with someone who's wanting to lose their weight, and that's what we find, that when a person diets, they find they're hungry all the time. Well, now there's a non-surgical solution that occupies space in the stomach and can help you be less hungry with that smaller amount of food that you ingest. And we know that it offers about 3 times as much weight loss as diet and exercise alone. So the big question is, how much weight can you expect to lose? As I mentioned before, it does not offer the same amount of weight loss as the surgical options, but it does better than diet and exercise alone, on the order of about 3 times as effective. The other benefit, and what as a weight loss physician, what I believe, is it's important for a person to have early success. If the success is very slow and very difficult, oftentimes it's hard to stick with that weight loss program or that lifestyle change. By using the Orbera balloon, we feel that patients can lose weight more quickly and thereby hopefully be more successful. The U.S. study that really fueled the FDA approval of the balloon showed an average weight loss of 22 pounds in 6 months. Following those people up for an additional 6 months for a year after placement, most of the weight loss was maintained. Now, 22 pounds seems low for some people, I'm sure, watching tonight, and the important thing to understand is that some people will lose more than 22 pounds. This was the average, and this included everyone, regardless of how well they stayed with the diet and exercise program, as well as whether or not the balloon stayed in. Some people had the balloon removed early, and their weight loss was still counted in this in order to provide a sound study. So when I place the Orbera balloon, as I mentioned before, I do it using an endoscopic technique, or using a scope. Many of you have probably had scopes before. I place the scope as well as the device down into the stomach. I then blow up the balloon with saline through a needle, and once I've inflated that balloon, I then remove the balloon from the catheter, and the balloon floats in the stomach. It's a very smooth, spherical balloon, so it doesn't have any rough edges that may cause ulcers or injury to the stomach. It occupies space in the stomach, as well as slows down the emptying of the stomach. So when a person eats or drinks, that food or liquid tends to stay in the stomach longer. Combine that with the balloon, and what we know is that tends to create a lasting feeling of fullness that doesn't go away quite as quickly with that small amount of food that a person eats. It takes about 20 to 30 minutes. The person goes home the same day. Typically, I do them under general anesthesia to protect the airway while it's placed and removed, because of the risk of aspiration of gastric contents during placement and removal of the balloon. Now, when I go to take it out, and it always has to be taken out at 6 months because of the risk of some of the complications, but I go down with the same scope, and I pierce that balloon with a needle. And once I've pierced that balloon with the needle, I can aspirate all of that saline, because it's a saline-filled balloon, and I aspirate that saline, and then I can pull that balloon out through the person's mouth without requiring any incisions or any surgical scars. Again, I do it under general anesthesia, but it's a relatively straightforward procedure. The person's still going to go home the same day and still have that quick time to recovery. Now, we know that the first week with the Orbera balloon can be challenging for some people. Some people can be sick for the first 3 to 5 days. The percentages that are shown on the slide with nausea, vomiting, and abdominal pain are actually seem quite high, and they are. But understand, these are from the study where medications were not used to help control these symptoms, because the researchers really wanted to understand what the expected side effects would be. With medications that I'll prescribe to help, the feeling is that these side effects for most people can be much, much improved. Now, we know that the balloon does not work by itself. It's not a magical tool. It's not going to magically make you lose weight. But what the balloon does is it helps you adhere to your diet. It helps you to eat a smaller amount of food without feeling hungry all the time. When we combine that dietary changes with exercise and the coaching and the counseling and the extensive support that we provide here at SSM, we feel that you can achieve your long-term weight loss goals. So what can you expect from me, from our team at the Weight Loss Institute? First of all, you can expect 24/7 support for the first week as you're going through the nausea and vomiting. In addition, any of my patients that ever have problems, they always have a surgeon available to call. For the first 12 months then, or the 12 months, 6 months while the balloon is in and 6 months after it's out, we provide extensive aftercare. What I believe is a level of aftercare that will rival anywhere else you can find. And this is going to include nutritional counseling, it's going to include behavior modification, as well as fitness counseling. Now at 6 months, as I said, the balloon has to come out. And as it comes out, the tendency would be that as a person loses restriction, the question is, well, why would I go back to just eating normal amounts of food? Well, the reason is because during the first 6 months, and then reinforced in the last 6 months, is going to be those lifestyle modifications, those lifestyle changes that will help you be successful long term. In addition, we have a medical weight loss physician at the SSM Weight Management Center that is going to continue and help you along your process, potentially even using medications and other things to help you continue to be successful. We also, and what's unique here, is we have an in-house meal replacement program. This can be combined with the balloon for some people as appropriate. Sometimes it can be utilized after the balloon is removed, but the combination of these two things can be highly successful for people. Now, the big question is what it costs. Insurance companies don't cover the balloon. Insurance companies may not cover the balloon for quite some time. However, we have come up with what we feel is a reasonable amount to expect. And again, it's from an entire 1-year program. This is not just to place a balloon and take it out. This is a comprehensive program for an entire year. This includes a balloon placement and removal. It includes the 12 months of aftercare, meaning the getting ready to have the balloon put in, the balloon placement, the balloon removal, and all of the care in the meantime during that year, as well as 24 access to our team. Now, the cost for the balloon at SSM is $7,250. That seems like a lot of money, but there are financing options available to help a person potentially make it more affordable and to fit into their budget. At the end of this, the big question that you have to ask is the Orbera balloon right for you? Is this a procedure that I should undertake? So what are some easy things to know? First of all, is it the right thing? First of all, we only do it in adults, so a person has to be over the age of 18. Second of all, it's only approved by the FDA for a person with a BMI between 30 and 40. BMI stands for body mass index, and this can be calculated through a simple internet online search. Finally, and probably most importantly, is a person has to see this as I'm going to participate in this medically supervised comprehensive weight loss program. In order to be successful, this is probably the most crucial thing with the balloon placement. So we'd be happy to answer any questions. Thank you guys for listening and listening to about this new procedure that we're offering at SSM.
Thank you very much. Yeah, it really is a fascinating procedure. And I do want to make sure everyone knows if they do have any questions that they'd like answered tonight, you can go ahead and tweet us your questions. Our Twitter handle is SSM Health. You can also post on our Facebook page, or you'll see an email address at the bottom of your screen there, askssm@ssmh.com. Okay, we do already have some questions, so we do want to get right to those questions. In that very last slide, you referenced a BMI of 30 to 40. We've had several different people email their questions in saying the BMI is right above that threshold, talking about 41, 42, even 43. What would you do in a case like that?
Yeah, that's a great question. And again, what I want people to understand is that this is not, again, it's not about just putting a balloon in. It's about helping you lose weight and make the lifestyle changes for the long term. So whether maybe we start that a little bit ahead so you can achieve that BMI of 40 or lower to qualify for the balloon, or whether it's, and then continue that on through the program, we can do that. And we offer all of those solutions for patients at our Comprehensive Weight Management Center.
That's great to hear. You also, in that last slide, you referenced really the team approach and how it isn't just a balloon. There's much more to it in those days, weeks, even months after. Why is that part so important, do you think, that team approach and the counseling aspect, not just the actual medical procedure?
Well, it really comes down to thinking about it in two ways. Number one is that the balloon is not an irreversible solution. I'm not modifying the stomach. I'm not taking any stomach out. I'm not rerouting the intestines. So when that balloon comes out, the stomach potentially, or the person can potentially, over the long term, eat more in a similar volume to what they did before the balloon was placed. So the comprehensive professionals used here are important to help the lifestyle changes that are necessary to lose weight for the long term. In addition, as I mentioned at the beginning, weight, obesity, and weight loss are very complex mechanisms. As a professional and in the field, we don't even understand all that goes in to controlling a person's weight. What we do know, though, is that there are a lot of inherent metabolic reasons that a person makes it difficult to lose weight. And so it's not just as simple as I'm just going to eat a little bit less, but it's also when a person eats, what time of day, how they eat, how quickly they eat, the types of foods that they eat, as well as the amount of calories that are burned through both daily activity as well as focused exercise. And it's all of those things that we address here at SSM.
A question coming in asking if there are certain things that you cannot eat or drink while the Orbera balloon is in place in the stomach. Anything that you have to avoid?
Right. That's a great question. The goal with the balloon is not to put you on a liquid diet for a year. Okay. The goal with the balloon is that it helps you eat the same types of healthy foods that you should be eating, but just in a lower amount. Now there is a preoperative diet to help make sure the stomach is empty of all food before we put the balloon in, as well as a postoperative transition to allow your stomach to adjust to having this balloon in, so that you don't have issues with retaining solid food for those first few days or first couple weeks while the balloon's in. So we'll carefully walk you through that process. But after that first month, for that last 11 or the last 5 months while the balloon's in, most people are going to eat fairly normal foods.
Okay. A question coming in, someone saying they read somewhere that the balloon can be placed for 6 months and it can be taken out for 6 months and replaced again in another 6 months. Is that true? And how many cycles like that could you do?
Yeah, absolutely. So the FDA approval is that the balloon can only stay in for 6 months. However, after that 6 months, once the stomach has recovered, we can place another balloon because we don't feel like that there's any increased risk of damage to the stomach. Part of the reason it can only stay in for 6 months too is that it may deflate after 6 months because we don't know what the durability is. It's probably a lot more durable than that, but again, we're going based on a research study and what the FDA has approved based on that research study. But we can we can place a balloon, after 6 months take it out, and then place another balloon without any problems.
So let's talk about that after the 6 months when the balloon is removed. Is your stomach, does it stay about the same? Do you see any shrinking of the stomach once it's removed?
Right. So now we know that the balloon, while it's in, induces what we call gastroparesis, or the stomach does not empty as well. This is a reversible change. When the balloon comes out, we know that goes away. We don't expect that the stomach is going to change size. What I believe is, though, that a person's neurological response or their brain's response to the stretch of the stomach can change after a prolonged period of it not stretching as much. So what we see a lot of times when people diet and extensively diet and do well is that they find that after, say, 6 months or a year of dieting, they don't feel as hungry, they can't eat as much. I don't believe that the stomach has significantly changed in shape or size, more though that the brain's feeling of fullness has changed. And what the hope is with that balloon in place and eating less amounts of food, that we can essentially retrain the brain to accept less food and therefore feel full with far less amount of food.
I believe that makes perfect sense, really. You talked about the out-of-pocket costs for the Orbera. Is it covered by insurance?
Yeah, that's a great question. Weight loss procedures in general are sometimes covered by insurance and sometimes are not. We do know that by watching other procedures and the time that it took to become approved by insurance, whether that's Medicare or private insurance companies, it can be quite significantly a long time. Right now, at the present, insurance companies are not covering the Orbera balloon. It doesn't mean that it won't at some point in the future, but I think it will be quite a while in the future, and we're not probably talking months, weeks or months. We're probably talking it'll be years before it's covered by insurance companies.
Okay, well that's good to know. This question coming in from a couple different people who have previously had the lap band surgery, but they have had it removed. Would they be a candidate for the Orbera balloon?
Yeah, great question. We see as people have had previous weight loss surgery and potentially gained some weight, the question is what solutions are there? Now, we offer a lot of different solutions for that at SSM. I'm happy to see people for other procedures that have not or have started to gain weight after those. Unfortunately, the balloon cannot be placed in if you've had previous surgery on the stomach. And there's a few reasons, but the biggest one is we don't know what happens to the integrity of the stomach after you've operated on it, after you've sutured it, after you've stapled it, or after you've put a band around it. And the potential concern would be that if the stomach is weaker after that, there may potentially be an increased risk of a perforation in the stomach when this balloon is in the stomach.
Okay, let's talk a little bit more about the actual procedure. How big is this balloon that you're talking about? And tell us a little bit more what actually happens when you come in for the procedure.
So this is the balloon right here. It's sitting in the palm of my hand, so it's significantly smaller than my hand. It holds about 600 cc's of saline, so it's about the size of a grapefruit. Again, it's put in under anesthesia, but it's not the deep anesthesia that a typical surgical procedure necessarily is going to be put under. A person would be put under for. A person's going to go home the same day, so we place it. It takes 20 to 30 minutes to place. After a person wakes up and recovers, they're going to be able to go home. Some people ask about time off of work. It's variable, and it all depends on how much nausea or difficulty you're having. If your nausea is well controlled, you can go back to work the next day from my standpoint. There's no real restrictions from you going back to work. You're not going to cause the balloon to rupture or to cause it to go out of the stomach or anything if you go back to your normal daily life.
If you are having some of that nausea or vomiting that's really affecting your everyday life, would you recommend your patients take some kind of prescription medication to help control that, at least for that 3 to 5 days when it is at its worst?
Yeah, absolutely. And part of the process is I'll give you some prescriptions, both to help any abdominal cramps as well as to help the nausea. And we have a lot of different options in that area to help those things. And so you'll have those prescriptions after the balloon when you go home, or even potentially before you go home, in order to make sure you can take these things to help control any nausea or cramping that you may have.
After that first week, any other side effects that people should be looking out for?
The big thing that we worry about is the balloon deflating. Okay, so if the balloon deflates and the saline leaks out, it potentially can pass down to the intestine and cause an obstruction. So the natural question then is, well, how do I know if it's deflated? Sometimes patients will have a change in their symptoms. Okay, so they'll lose that feeling of restriction that they had, and sometimes it can be quite significant. The other thing that I do is I put a blue dye, in the saline as I fill the balloon. The blue dye is taken up into the blood. It's not harmful for a person, but then when they urinate, they actually urinate green. And so if a person has a balloon and then they start to urinate and it's green, that's always a reason to call me immediately.
If the balloon isn't working out for a patient, can it be taken out?
Yeah, absolutely. Whether that's at 1 month, 3 months, or 5.5 months, or whether it's the day after, if it's ever causing an issue and a person can't tolerate it, we can always take the balloon out.
How does someone know if they qualify for this new procedure?
So the first thing to look at is what is your BMI? Okay, your BMI should be in the general range of 30 to 40, but as I said earlier, if it's higher than that, we have other solutions to help you, potentially to help you get ready to have a balloon. Second of all, we do only do the balloon. It's only approved for adults. And then finally, and the biggest thing is the person has to be willing and motivated to participate in that 1 year weight loss program, because that's how a person will be successful.
Absolutely. Talk a little bit about, we do have some people writing in who do have type 2 diabetes. Would this procedure, would it be a factor in helping them control and manage that disease?
So the balloon is different than some of the surgical procedures I do. Some of the surgical procedures actually do affect a person's hormones that thereby can improve their diabetes by making a person more sensitive, for instance, to insulin. The balloon is not going to do that, but the balloon offers weight loss. And by offering weight loss, it can improve a person's diabetic control. Studies have well documented that with even as low as a 5 to 10% amount of body weight loss, a person's diabetes, the progression of their diabetes can slow, and actually their hemoglobin A1C, which is a marker of long-term diabetes, can become improved. So through the weight loss that the balloon offers, a person's diabetes can definitely improve, as can other medical conditions that are associated with obesity.
Can someone have the procedure done if they live out of state? Can they come in to have it done?
Yeah, so I am happy to help a person wherever they live, whether that's with a balloon or something else. The big thing is being able to follow up with the aftercare. As I said earlier, the aftercare is the key portion and the key thing for the balloon to be successful. You know, my goal is not to put as many balloons as possible in people. I'm not a used car salesman. At the end of your visit, I'm not going to ask you, what can I do today to get you into a balloon? My goal is to help you be successful. And if the balloon's not right for you, then let's come up with another solution. But again, being able to follow up with the aftercare is going to be 99% of the long-term success rate for the placement of the balloon.
A question coming in from a gentleman saying that pain in his back keeps him from exercising, but that no exercise in his life is meaning higher blood pressure and other health complications. Can he do this regimen? You know, we're talking a lot about lifestyle changes and how it is an overall bigger picture goals with a healthier lifestyle. Could he do this without a lot of exercise, or at least taking his chronic back pain into account?
Yeah, absolutely. I mean, simply the restriction of calories is going to help a person lose weight. And the hope is, and what I've seen by helping people lose a lot of weight, is that through that weight loss, a lot of those chronic joint or back problems can improve, and a person can do things they haven't done in years. There are things also that will help a person with through fitness and exercise counseling, things that you can do even if you are limited from whether it's joint pain or joint issues or back pain or issues, things that you can still do to help build muscle mass and improve your metabolism. But the hope is that also with the weight loss that people will be able to do things they haven't done in years.
Yeah, absolutely. Talk a little bit more about the results with Orbera and the average weight loss and what happens in those months following the balloon.
Yeah, so we know that in the months following the balloon, the weight loss was fairly well maintained, within a few pounds. 22 pounds probably seems low to some people that are considering having a balloon placed. Again, this is the average. Some people are going to lose more than this. What we don't know is how much is a person going to lose 2 years, 3 years, 5 years, 10 years from the balloon. And my hope is that by using this as an early tool to help a person lose weight, that long term, through those lifestyle changes, that weight loss and that healthy eating and those healthy behaviors can continue down the road. And through the support here at SSM, we're gonna work to ensure that happens.
Any potential complications from the Orbera intragastric balloon?
So, okay, as with anything else, there are always potential side effects or complications. Now we know that as compared to surgical procedures, the rate of complications is much lower. After a surgical operation, oftentimes the complication rates, can be around 10 to 15%. With the balloon, most complications we're talking a less than 5% chance. The major complications, things like the balloon rupturing, the balloon deflating, leaking, and thereby potentially causing a bowel obstruction, injury or perforation of the stomach, as well as gastrointestinal bleeding induced by vomiting from the balloon, are all relatively very, very low. Even the need to have it removed early is a relatively infrequent thing that happens.
What are some of the things that people need to consider and think about when they are deciding between maybe this newest procedure, another form of weight loss surgery, or maybe a weight loss or weight management program? What do they need to really look at, and what pros and cons do they need to be thinking about?
I think the biggest thing that a person needs to consider as they're thinking about these different things is, first of all, what is the support that I'm going to have? What is the professionals that what are the professionals that I'm going to be working with going to be doing to help me achieve results? If you're looking at a place that's just going to offer a bottom dollar to just put the balloon in and take it out and then say, well, go find somewhere where you can have the other things offered, I would be cautious, because again, the long-term success of the balloon comes with the lifestyle changes that can happen through a comprehensive weight management program. Of course, the cost of the balloon is important, and if a person can't afford the cost of the balloon, don't be discouraged. We can look at and work potentially at other things. Some people, it may be that the balloon doesn't offer a high enough weight loss solution. If a person is trying to lose, say, 75 or 100 pounds or more, again, don't be discouraged. We have other solutions that we can help a person with. And sometimes people are in a position where they don't feel like at this point in their life they can have a procedure or surgical operation. That's okay. We offer non-surgical, non-procedural based weight management solutions here at SSM as well.
And it sounds like we can really learn a lot from that initial consultation, talking with you, the other surgeons, the other program managers here about what would work best for their situation that they're in right then and now.
Yeah, if once a person comes to the point and they say, the balloon is a real option for me, and I'm interested in that, definitely come in and see me. We can talk about it. We can talk about the ins and the outs, and potentially even talk about other things that a person may be interested in. Again, I don't necessarily see a person as, well, this person is a balloon candidate. This person is a gastric bypass candidate. This person is a gastric sleeve candidate. The way I see a person is, this is a person who wants to lose weight. Now let's figure out a way to help you do that, and hear all of the vast amount of options that we have to help you on that process.
We do have time for just a few more questions, so if anyone out there watching does have a few more questions they'd like Dr. Wheeler to answer, you can email those questions to askssm@ssmhc.com. Another question coming in via email, we do have a question saying that someone has started consultations for lap band surgery, but now maybe thinking they are interested in Orbera. Would they need to start those consultation visits over?
Sorry, say that one more time. They what?
Someone may be interested in Orbera instead of a procedure they were originally thinking of. Would they need to start the consultation process over at the beginning?
Well, I would want you to come in so we can talk about the balloon, okay? Although the tenets of weight loss in terms of the foundation with diet and exercise are similar, we do need to talk about what's involved with the balloon, what have an individual conversation about the complications, and because there are some, as I mentioned, stomach surgery and things like that, there are some contraindications to the balloon. I need to be able to review that person's medical history again to have that conversation about whether or not the balloon's right for them.
Someone emailing in wanting to know if you've ever, or if research has shown that food actually sticks to the balloon once it's in your stomach.
Yeah, that's a good question. We do know that sometimes, like bad breath or halitosis can happen after the balloon because some of the ingested food does not completely get cleared off. It's probably not that large chunks of food are adherent to the balloon, but more of just kind of a film. Oftentimes, we can by going back on some liquids, we can even use some soda and things to kind of cleanse the balloon, and then those side effects can go away.
It really is a fascinating procedure that a balloon is put in your stomach. And there have been so many developments in the weight loss world, really just over the last couple of years. What do you see? How do you see the future of this industry really going in the next couple of years?
I see the future of weight loss is going to come with a comprehensive program. Traditionally, a physician or a surgeon would maybe set up shop and offer one or two things. They would say, okay, I'm going to write medications, or I'll do the gastric sleeve or the gastric bypass. The future of this is that as more and more things are approved as safe and effective, the ability for a center to incorporate these things and thereby treat a person utilizing all the resources possible. So whether that's a person who's had a previous gastric sleeve and they gain back weight, what are the options to help a person lose more weight? Or if it's a person who doesn't qualify for a weight loss procedure because their weight is not quite adequate, what other options do we have? Whether that's lifestyle changes, behavior modification, plus or minus a balloon or a medication. But the future of weight management is going to come down to a comprehensive approach utilizing many different safe and effective options to help a person achieve their goals.
Well, that was a last question that we had emailed in. Anything you'd like to end us with this evening, Dr. Wheeler?
I don't think I can say enough of how important it is to partner with, and it really is a partnership, but to partner with a physician, a weight management service, or weight management center that offers a comprehensive approach. There are programs that are out there, whether it's in St. Louis or around the country, that can offer you a bottom dollar, put the balloon in, take it out. But I can promise you that if that's all that you have, it's going to be very difficult to lose weight and keep it off for the long term. Really look for a place that's going to partner with you to offer a comprehensive approach to help you be successful.
Okay, thank you very much. Thank you for everyone who watched and who sent in all your great questions. Thank you, Dr. Wheeler, for sharing all of this valuable information. And if you're looking for more information or providers in your area, please visit our website, ssmhealth.com/live. And we will also be taking more questions on that email, askssm@ssmhc.com. So if you think of anything else, feel free, email it in, and we'll make sure we get your questions answered. Thanks for tuning in. We'll see you next time.